Well, ladies, if you are watching this morning, our next topic may be something you are familiar with. If you're a woman who has heard of bunions or you have them, then you know just how painful and often unsightly they can become. Well, this morning we've got a way to get rid of the problem. Here with more is foot and ankle surgeon, Dr. Marvin Brown. Thank you, Dr. Brown.
Good morning. Thank you.
A lot of women are going to be glad that you're here this morning. First of all, I've got to ask you, how often do you see the problem with bunions, and what are they exactly?
All day long, every day.
All day, every day.
And what a bunion is, it's a growth on the inside of the foot, and it's stimulated by two things. There's two types of bunions.
Okay.
One, wearing bad shoes, pushes on the foot, pushes your big toe over toward the little toes.
Yeah.
And the inflammation over time builds bone and you create a bunion. And then the other type, you're born with.
Okay, now I've got to ask you, when you say bad shoes, do you mean shoes that are cheaply made or shoes that fit too tight or fit poorly, or what? How do you define a bad shoe?
Expense doesn't come into that, and sometimes the most expensive shoes are even the worst.
Okay.
But what you want is a shoe that will fit your foot.
That will fit your foot. Okay, now you talked about the different kinds of bunions. We often hear something also called hammer toes.
So the longer you have a bunion, your big toe moves toward the little toes and it starts pushing on the little toes.
Okay.
And eventually what happens, the second toe comes over the big toe.
So what I'm hearing is that the bunions don't get better without being treated. They go from a bunion to a hammer toe and you just got a problem.
Right.
Yeah, and then people, of course, obviously women who have this problem are uncomfortable wearing nice shoes that will show their toes. Let's talk about what you do to treat this condition.
Well, the first thing that we do, the only reason to have a bunionectomy is pain. So since it's the shoe that's pushing on the foot that causes the problem, the first thing we try and do is encourage you to get shoes that fit your foot.
Fit properly. I love shoes, Dr. Brown. I'm thinking of a million things here as you're talking. Now, we've actually got Kim Spradlin here, and I want Kim to come in because you want to show us something here that you've brought. Tell us what you've brought and what we're going to learn.
So how do you know if your foot fits your shoe?
That's what we want to know.
Oh, gosh.
Okay, let's see what we can learn here.
I told Roger this is how every girl wants to find out if they have bunions
now,
on
Dr.
TV.
Brown, do you do this with your patients just to give them a, okay?
And I do have on.
Oh, and she has such a nice thin foot, no bunions or hammer toes.
Right.
I'm scared you're about to tell me I have all kinds of foot problems because I've never been.
So what I do is I suggest that people draw a line around their foot like this, and then they can take their shoes from their closet.
Okay.
Like this one.
And we'll line it up. But see how much she has to squeeze her foot together
Oh, I
to
see
fit
The
the
foot
shoe.
is larger than the
I
shoe.
see that.
And
This
so
is a
years and
stepsister
years
thing.
of that pressure is what causes the problem.
Problems. Thank you so much, Kim.
Yeah, for
Doctor,
sure.
let's go back because I want to talk about, obviously, that can give you problems if you're wearing a shoe that doesn't fit properly. Let's talk about some of the foot deformities that can become a problem over time.
Well, this is showing you a progression, and so here they start out with a normal foot, but see how the big toe starts moving over, crowding the lesser toes, and if you take your shoe off and there's too much pressure, you see a red spot.
Yes.
Now, the other thing is you can get pressure on the other side as this progresses, and the foot spreads out a little bit, and so this is called a bunionette. Bunion on the inside, bunionette on the outside. And then you develop painful hammer toes, and so if you take your shoes off and the knuckles of your toes are red, you're putting too much pressure on the toes, and it's going to cause a hammer toe then.
Dr. Brown, a lot of good information. Most important question of the segment, what if it's a really hot shoe and you can't do without it?
Well, what I
You just have
recommend
to have
is,
it, Dr. Brown.
for special occasions, great, but
not every day.
get dropped off at the door, get picked up at the door, have a pair of comfortable shoes in the car waiting for you.
If not, you got to go see Dr. Brown. He's happy to help if you need to. The San Antonio Orthopaedic Group, here's their phone number, 281-9595. And if you're home today, peruse the website, TSAOG.com. That's www.tsaog.com. A lot of good information. Dr. Brown, thank you.
Thank you so much.
Got to rethink those shoes.